What is tolerance? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication. And one of the things that has come up is talking about what exactly is tolerance. So tolerance is a phenomena where you need a higher and higher dosage of the medication or substance or whatever you're using in order to get the same therapeutic effect. So we usually think about this with medications like benzodiazepines, stimulants, as well as antidepressants. So for example, you might start out on a dosage of Ativan of 0.5 milligrams per day. And then eventually you notice that that's not as effective as it used to be. And so you slowly increase the dose to 1 milligram a day, and then maybe to 2 milligrams a day. And then eventually you get to a ceiling dose where it's no longer really helping you, but you're actually kind of stuck on that medication or substance. Because at that point, if you have tolerance, then you also most likely have dependence, which means that if you stop that medication or substance, you're likely to develop symptoms of withdrawal. Now, when I was in training, we were taught that tolerance is something that develops over time. And so you may have months to years before it may develop, but eventually most people are going to get tolerant to things like benzodiazepines. But experts in the field of deprescribing, like Dr. Mark Horowitz, talk about how tolerance actually can occur quite quickly in the same sort of hyperbolic fashion. So you may develop tolerance at a rapid rate in the beginning, and then after that, you're only becoming more tolerant very slowly over time. And so it may be that there are some individuals who are more at risk of developing tolerance, while others may be able to take the same dosage of a medication for years and years and still find benefit from it. But if you do find yourself in the position where you're noticing that you're becoming tolerant quite quickly, then it's important to be aware of the fact that you may have more difficulty getting off of that medication. If you have an experience with tolerance and you want to share it in the comments below, feel free to do so. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings or resources, and I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email and I'll see you in the next one.